pain is a real common complaint. Dr. Reginald Davis from GBMC is here with some advice, and you are a neurosurgeon, is that correct?
That's correct.
All right, well, Happy New Year's to you. Thank you so much for coming in this morning.
Well, thank you for having me.
You're welcome. Well, back pain can range from anything that just comes and goes to chronic for people.
That's correct. Basically, back pain is very ubiquitous in our society, affecting up to 80% of adult population at some point. And it ranges, as you have pointed out, from minor sprains, which are self-limiting, to very, very chronic back pain, which sometimes is indicative of a serious underlying condition, which ultimately requires some medical attention.
This time of year, a lot of people out shoveling snow and may have an event later on this week, so you probably see a lot of folks coming in with pain from that.
Yes, we do. That falls into the category of the spurious intermittent variety. But even then, it requires some treatment and care.
That chronic back pain can be very debilitating. A lot of folks will suffer depression from that because it just lasts and lasts and lasts. What are some of the treatments for that?
Well, the treatment for the back pains actually have a large range depending on the severity and the condition that's underlying. The simple sprains that we've been discussing are usually treated with analgesics or medications, heat, relaxation, altering the activity that seems to be precipitating the pain. As it gets more serious, sometimes the medications become stronger. We implement physical therapy, chiropractic manipulation and treatments. And then there are more potent medications and even injection therapy.
The injection, so who's a candidate for something like that?
The candidate for the injection is one who has a more persistent pain. Oftentimes this is pain that's radiating into the legs as well. And then a diagnosis such as a pinched nerve or a sprained nerve or inflammatory disease of the joint or the disc, or you're treating a specific ailment at that juncture.
Of those who get the injections, they get them at intervals, and then sometimes they cannot be as effective over time. So when does that move into the range of surgery? Well,
again, it depends on the spine specialist and the team that's involved. But as a general rule of thumb, the injections work very well at the beginning. Sometimes they taper off. And after 3 or 4, if you're getting into the realm of ineffective injection and persistent incapacitating symptoms, then it's time to consider surgery on the appropriate candidates.
At what point when you have back pain do you say, I really need to see a doctor?
That's really up to the patient when the pain is really affecting their life, interfering with daily activities. Also, when the pain is associated with neurological problems, such as radiating to the legs, weakness or numbness, or even bowel or bladder dysfunction. Acute neurological deficit actually precipitates an emergency and is a very serious consideration for seeing the specialist.
All right, thank you so much for coming in and joining us this morning. Certainly appreciate it. You're welcome.